Alzheimer's disease, a diagnosis that casts a long shadow. It slowly steals our memories and cognitive abilities. Millions live with Alzheimer's, and that number is increasing. The impact extends far beyond the individual. Families become caregivers, their lives changed. The burdens are immense, highlighting the need for awareness and support. Alzheimer's disease often begins subtly, with symptoms so mild they might be mistaken for normal aging. It's easy to dismiss occasional forgetfulness or slight confusion as simply part of getting older. However, recognizing these early signs is crucial for timely diagnosis and intervention. Memory loss that disrupts daily life is a common early symptom. This goes beyond forgetting appointments or names. People might forget recent conversations, important dates, or familiar routes. They may also struggle to recall words or follow storylines. Difficulty completing familiar tasks is another red flag. These challenges arise because Alzheimer's affects areas of the brain responsible for planning, problem-solving, and spatial reasoning. Changes in mood and personality can also signal the onset of Alzheimer's. Individuals may become withdrawn, apathetic, or easily agitated. Early detection and support are crucial. As Alzheimer's progresses, symptoms become more pronounced and debilitating. The middle stages are the longest and most challenging, requiring significant adjustments. Memory loss intensifies, making it difficult to retain new information. Communication becomes increasingly challenging. Frustration and social withdrawal are common. Disorientation and confusion worsen. Individuals may wander and experience changes in sleep patterns. These changes demand increased supervision and support. Despite extensive research, the exact causes of Alzheimer's remain elusive. However, scientists have identified several factors that contribute to its development, offering valuable insights into potential prevention and treatment strategies. Age is the most significant risk factor, with the likelihood of developing Alzheimer's increasing dramatically after the age of 65. While the disease is not a normal part of aging, the aging brain is more vulnerable to the changes associated with Alzheimer's. Genetics also play a role, with certain gene mutations directly linked to the development of early-onset Alzheimer's, which occurs before age 65. Family history of the disease is also a risk factor, although having a relative with Alzheimer's doesn't guarantee you'll develop it. Lifestyle factors, while not directly causative, are believed to modify the risk of developing Alzheimer's. Conditions like heart disease, stroke, diabetes, and obesity have been linked to an increased risk, suggesting that maintaining cardiovascular health is crucial for brain health as well. Protecting your mind prevention strategies. While there's no guaranteed way to prevent Alzheimer's, certain lifestyle choices can reduce your risk. Regular physical activity is crucial for brain health. Exercise improves blood flow, delivering nutrients and oxygen. Mental stimulation through puzzles, reading, and social activities is also important. A heart-healthy diet rich in fruits, vegetables, and whole grains supports brain health. Challenges along the way. Complications of Alzheimer's. The progression of Alzheimer's disease often brings a cascade of complications, impacting not only the individual but also their caregivers and loved ones. These challenges can be overwhelming, demanding patience, compassion, and a strong support system. As cognitive function declines, individuals with Alzheimer's become increasingly vulnerable to infections, particularly pneumonia and urinary tract infections. Difficulty swallowing increases the risk of aspiration, where food or liquids enter the lungs, leading to serious respiratory problems. Falls and injuries are also common complications, as disorientation and impaired coordination increase the likelihood of accidents. Bone loss and frailty, often exacerbated by reduced mobility, further elevate the risk of fractures and other injuries. The emotional toll on caregivers is immense. They often experience burnout, stress, anxiety, and depression as they navigate the demands of providing round-the-clock care. Recognizing the need for self-care and seeking support groups or respite care services is crucial for caregiver well-being. Managing the disease, current approaches. While there is currently no cure for Alzheimer's disease, various treatment options are available to manage symptoms, improve quality of life, and potentially slow the progression of the disease. These treatments often involve a multidisciplinary approach, addressing both cognitive and behavioral aspects. Medications, such as cholinesterase inhibitors and memantine, are commonly prescribed to manage cognitive symptoms. These drugs work by regulating neurotransmitters in the brain, temporarily improving memory, thinking, and communication skills. Non-drug therapies, including occupational therapy, physical therapy, and speech therapy, play a crucial role in maintaining physical function, independence, and communication skills. These therapies adapt to the individual's changing needs as the disease progresses. Creating a supportive and structured environment is essential for individuals with Alzheimer's. This includes establishing a consistent routine, minimizing distractions, ensuring adequate lighting, and making the home safe and accessible to prevent falls. Hope on the horizon, emerging treatments. The fight against Alzheimer's disease continues, with scientists around the world working tirelessly to develop new treatments and ultimately find a cure. While the journey is long and challenging, recent advancements offer a glimmer of hope for the future. One promising area of research focuses on monoclonal antibodies, laboratory-produced molecules designed to target and clear amyloid plaques, one of the hallmarks of Alzheimer's in the brain. Clinical trials are underway to assess the efficacy and safety of these treatments. Brain stimulation therapies such as transcranial magnetic stimulation, TMS, and deep brain stimulation, DBS, are also being explored as potential treatments. These non-invasive techniques aim to modulate brain activity, potentially improving cognitive function and slowing disease progression. Other research avenues include investigating the role of inflammation, oxidative stress, and vascular health in Alzheimer's development. Understanding these complex interactions could lead to novel therapeutic targets and preventive strategies. A future with Alzheimer's conclusion. Alzheimer's disease presents a formidable challenge affecting millions worldwide. Understanding the disease, recognizing early signs, and exploring treatments is crucial. Early detection allows for timely intervention and effective treatments. Ongoing research offers hope for more effective treatments and a cure. Supporting individuals and caregivers is essential. A collective effort is needed to unravel Alzheimer's mysteries and find a cure.